Good morning, Mr. Orange. My name's Stephanie Guy. I'll be your nurse today. Before we get started, let me verify your name, your date of birth, and do you have any allergies? Thank you. We have new doctor's orders on you today. The doctor wants me to do a wet to dry dressing change on that incision that's on your abdomen. Before we get started though, I do want to explain to you about the procedure. It will involve changing the old dressing, applying a new dressing. Now it can be painful or uncomfortable. I would like to ask you if you have any trouble with pain right now. If you do, rate it on a pain scale from 0 being the least amount of pain to 10 being the most amount of pain. If you do have pain, I'm going to get you some pain medicine and let you have about 30 minutes to rest and get to feeling just a little bit better before I start the procedure. Okay, let me gather up my supplies. For this procedure, we will need a dressing tray kit. We'll need some hand sanitizer or method to wash our hands. We'll need the solution that we'll be using in the wet to dry dressing. In this case, we're using sterile water. You'll need a waterproof marker, a sterile tongue blade, and a couple pair of clean gloves. Let's sanitize my hands first. Open up my kit. And I'm going to roll the top down, and we're going to use this as the waste receptacle. Open it wide, and I'm going to place it right here by your dressing. I'm going to leave my kit closed on the table and we'll open it up in just a few minutes. Right now I'm going to remove that old dressing from you and measure your wound. Okay, I'm going to remove this from the bottom going upwards. So if there's any bad odors, it won't affect you quite so badly. As I remove these, I'm going to count the number of dressings that I have. I'm going to note any odor, any exudate. I'm going to notice how many dressings I remove. There's 1, 2, 3, 4, 5 4x4s. And then I'm going to remove the packing. I'm going to note the size, the color of the wound, and now I'm going to measure the wound. For this procedure, I'll use a sterile tongue blade, or you can use a sterile Q-tip. Some kits even come with a marker that you can use. We'll measure the depth first. We'll measure the width next. Then we'll measure the length. Just place that to the side. I'm going to remove my gloves and then we're going to start opening up this sterile kit. Now we're going to go on and set up our sterile field. First I'm going to get the solution that we're going to wet our gauze with. Open it carefully, place the lid to the side where it's capped up, then place the bottle. Open your pack in a sterile fashion, furthest away first, side to side, and towards you last. Remove the sterile gloves from the kit, and we're going to put them on here at the corner of our table. Now I cannot turn my back on my sterile field, so I like to set up like this. Don't open your sterile gloves over your sterile pack. The blue draping that's in the kit, I'll use later for a procedure. That will involve picking up the sterile water and pouring it. So we're just going to place it to the side. I do want to keep it within 1 inch of the borders at all times. This is the biohazard bag. We'll use it later on. We do have swab sticks. We have sterile Q-tips, scissors, and tweezers. Now I like to use the largest container to keep all of my dry products in. That way if we get the paper wet later on, it won't become contaminated. Go on and count out how many gauze you need to keep dry. In the case of the dressing we just removed, we needed 5. 1, 2, 3, 4, 5. And put them over in your dry dock. The others are for cleaning, and it needs to stay over to the left side. Open your Q-tips. And then have them ready to go also. All right, now we need to pour our water. I like to take the blue pad, open it up a bit to where you're protecting your sterile gloves to grasp the solution with. You need to pour a slight bit of the solution out into your waterproof container. Then you need to pour solution on your gauze. The gauze that you'll be using for cleaning and packing the wound. Use a generous amount so that you'll get an adequate amount for cleaning. Then place this to the side. Now we're going to start our cleaning process. Take a 4x4 and fold it. Squeeze a little bit of the water out. And I like to press it against my fingers slightly, so I'm sure that I'm not going to drag this tweezer across that tender flesh. We're going to clean down the center first and discard. Clean down the side furthest away from us next. And as you can see, this is dripping. That's why it's important to keep this in a waterproof boat. Clean the side further away from me next. Clean the side closest to me next. Now we're going to clean the outside. Furthest away first. Discard, and then closer to the wound next. We can also use the betadine wipes to wipe furthest away from us and on the side. Take care that you find out if your client is allergic to betadine or if the doctor's order will contradict using that solution. Now you're going to grasp your roll of gauze and squeeze it out. We want this dressing to be wet, but we want it to dry so that it will grab the granulated material from the wound. When we remove it, it will bring the granulated material. Now we're going to start packing the wound with the gauze. I like to pack with my sterile fingers on a wound this large. Simply take the gauze, hold it up off of the skin, and pack it into the wound. You do want to pack the wound nice and tight so the gauze will absorb any secretions from the wound. This is a large wound, so it will require most of this roll of gauze. While doing this process, be sure that you keep your fingers only within the wound. Okay, let's take a look at this. It's packed pretty nice and tight. I'm going to hold it to the side and go on and cut this. Now we're going to pack the top with the dry 4x4 gauze. Now we're going to take your ABD pad and place it on the wound to cover it all. You want to be sure that the blue strip is facing upward. It'll indicate if the pad is wet or not. Remove your gloves. Now we're going to put on another pair of gloves, clean gloves, and go on and close this wound off. Now we're going to go on and use our tape to close this dressing off. You're just going to more or less picture frame the dressing. You don't want to cover your entire dressing with tape, otherwise it'll become an occlusive dressing. This is the type of dressing that you want it to dry. Be sure it's nice and secure. Now we want to take a piece of tape and put the date on it and the time on it, military time, and your initial. Place this on the dressing, and this will indicate when it was changed last. Some kits even come with a label in it. How you feeling, Miss Orange? I'm finished with the procedure. You seem to tolerate it well. Now I'm going to take all of my waste and transfer it into a biohazard bag. I'm going to take my tweezers and my scissors and put them in a sharps container. We're going to take our solution, close it up, mark it with the date and the time. Now we're going to take the tongue blade where we put our marks on it earlier and measured it with a measuring device as to the depth, the width, and the length of the wound. Our documentation will include the date, the time, the size of the wound, the location of the wound and the dressing, the color, any execute date, and how the patient tolerated the procedure. We'll follow our closing steps by getting the patient in a comfortable position, lowering the bed to the lowest height, putting the call light within reach and side rails up, and making sure all is well with the patient before we leave the area.